أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد أشرف الأنبياء والمرسلين وعلى آله وصحبه أجمعين سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. Assalamu alaikum warahmatullahi wabarakatuh. My name is Hamidi Abdul Rahman. Today I'll be presenting my paper, Diagnosis of Jinn Possession Amongst Patients with Mental Disorders Using Thermal Imaging. First of all, I'd like to define the term possession. And I take this definition from the International Classification of Diseases. And there, in ICD-11, there is a disorder called possession trance disorder, and it's described as possession trance disorder is characterized by trance states in which there is a marked alteration in the individual's state of consciousness and the individual's customary sense of personal identity is replaced by an external possessing identity, and in which the individual's behaviors or movements are experienced as being controlled by the possessing agent. So the external possessing identity being referred to in IC11 is what we call Jinn in Islam. And Jinn possession is also embedded in the Islamic faith, as in the tafsir of Surah Al-Baqarah, verse 275 in Tafsir Al-Qurtubi. So Jinn possession can also be diagnosed via Rokia. Okay, that's the most popular and I would say the most reliable diagnosis for Jinn possession. So what is Rokia? Rokia is incantation using Sharia compliant methods, incantation using Quran, supplications, citations of the prophets, or whatever does not invoke shirk. So that's what Rokia is. So when you read Rokia on somebody, okay, and if that person has got Jinn possession, then there will be reactions to the Rokia. These are negative reactions. Example of negative reactions are feeling hot, vomiting, body, head or limb shaking, screaming, heavy breathing, Jinn speaking, sinister laughter, collapse or fainted, abusive, eyes flickering, strong pulse in stomach, struggle to vomit, unable to say the full shahada, eyes rolling, that means the eyes become white, sharp pain, aggressive or wanted to be aggressive. So anybody who has Jinn possession will likely to experience one or more of these symptoms. And Ruqyah practitioners regard this as an indication, okay, that the person has Jinn possession. Another study, a quantitative study, which has been published, analyzed 34 symptoms of Jinn possession, and in that analysis, it found that 23 symptoms were significant, whereas the other 11 were considered to be less significant. Okay. When we look at the symptoms of Jinn possession in that study, we see that some symptoms are also symptoms of mental disorders. So it's not surprising if psychologists or if psychiatrists will diagnose anybody with these symptoms as having mental disorder. So a person with Jinn possession, but also have the overlapping symptoms of mental disorders, will most likely be diagnosed as having mental disorder rather than Jinn possession. That's because psychiatrists do not want to know about Jinn possession. They're not trained to diagnose Jinn possession. They are trained to diagnose mental disorders. So it is possible that a person with jinn possession has been diagnosed with mental disorders. So we have to look at those who have been diagnosed with mental disorders and see if there is an underlying jinn possession problem as well. Okay, so we did an exploratory study by taking 4 case studies. Okay, the first is a male who has been diagnosed with schizophrenia. He has 6 significant symptoms of jinn possession: feeling suicidal, loner, seeing things, hearing voices, loss of ability to focus, and laziness. And the second case is a male who's been diagnosed with schizophrenia, having 5 significant symptoms of jinn possession. They are inability to focus, laziness, aversion from remembering Allah, hearing voices, and paranoid. And the third case, a female who has been diagnosed with bipolar disorder, having 5 significant symptoms of jinn possession: inability to focus, paranoid, loss of meaning of life, ill thoughts, and loner. And 3 non-significant or less significant symptoms of jinn possession: extreme anger, frequently anxious, and frequent headaches. And the fourth case, a female who has been diagnosed with epilepsy. She has got 6 significant symptoms of jinn possession: inability to focus, seeing things, loner, loss of meaning of life, extreme tiredness, and dream of poisonous animals. And 3 less significant symptoms of jinn possession: extreme anger, seizures, and loss of appetite. And all of these 4 subjects, they were taking medication for their respective disorders. So the method was to capture, to see the changes in temperature, because feeling hot is one of the reactions to Rokia for those who has got jinn possession. So in this case, we use a thermal imaging camera to capture the thermal images before and after Rokia. Okay. So initially, the camera was set to the same color spectrum, the same scale, with black showing the coldest and white showing the hottest. And the image of the participant were taken before Rokia, and then Rokia was read on the participant, and then another image, thermal image, was captured after Rokia, and the 2 images were then compared. The results for the case number 1, person who has been diagnosed as having schizophrenia, we see that after Rokia, the right foot and the hands became hotter compared to the one before that. So there has been an increase in temperature. For the second case, also a person who has been diagnosed as having schizophrenia, after Rokia, the face, the legs became hotter. And for the third case, this girl who has been diagnosed as having bipolar disorder, after Rokia, the whole body became hotter. And the fourth case, this girl who has been diagnosed as having epilepsy, and after Rokia, the face, the hands, and the legs become hotter. Okay. Feeling hot is one of the reactions to Rokia for those who have jinn possession. So in these 4 cases, the indication are that they all have a gene possession problem. Okay. So they have been diagnosed as having mental disorders. Why? Because psychiatrists will look at the symptoms of mental disorders, and yes, they have, and that's why they have been diagnosed as that. But if you want to see if they have gene possession disorders or not, then you can also look at symptoms or do Rokia. And in this case, through the symptoms and through Rokia, we can confirm that all four of them have got gene possession. So it is correct to say that in some cases of mental disorders, there are underlying gene possession problems. So in all, we can say that gene possession can be identified either through Rokia or by using symptoms of gene possession. And when we identify a person has got gene possession, obviously the logical thing is to get some therapy for gene possession, not just rely on the medication for mental disorders, because that will not sort out the problem of gene possession. Thank you very much.